Traditional Japanese medicine and traditional Chinese medicine, while they share historical roots, are actually drastically different in how they approach the patient. In today's video, I want to go through how those differences could possibly really enhance your current practice with your patients in getting better outcomes and helping you with your confidence. Are you interested in transitioning your practice from TCM into traditional Japanese medicine styles? Then let's chat. There's a link for a discussion in the description box below for an interview. Go ahead and click that, pick a time that works for you, of course. And let's talk about your goals for your practice and how ShinKyu University can help you bridge the gap between TCM and traditional Japanese medicine. So many practitioners get really confused about the differences between TCM and traditional Japanese medicine, not through any fault of their own, but it's just not really taught in most curriculums around the world. So in today's video, I'd like to go through some different theoretical differences, but also some different hands-on practices that you're going to see in TCM styles and also traditional Japanese medicine styles. Now, I have helped practitioners from all around the world help to transition their practice from TCM into traditional Japanese medicine. And there's one thing I can say that is an overarching true for everybody, and that is that even the adaptation of just a few different theoretical approaches to the medicine or changing a little bit of technique really does enhance your client outcomes and your confidence in the clinic. So when going through today's video, I want you to really keep an open mind and think about how can I change my practice to make it just a little bit better for my clients, and what am I missing in order to help me get to that point? This what am I missing question is really, really important because while a 10-minute video can totally be helpful and give you some hints and inspiration, it's not going to answer all the questions for you in your practice. So if you can go ahead and write down at the end of this video, what are you missing? What do you need to help really transition your practice and really get confidence in the clinic and get those better patient outcomes? Then you have a really good starting point on trying to find the information that can help you. Again, a really good thing to do once you have that list is to go ahead and set up an interview and let's have a chat. That interview link again is in the description box below. And really through that, all I do is try to walk you through what your goals are for your practice and what's kind of getting in your way and what could possibly help you. And whether that's ShinKyu University or a different program, I'm always open to have that discussion. So again, please, while you're watching this video, maybe have a pen and paper, write down some notes, and then have a thought afterwards, and then let's have a chat. So the number one thing that when most people think about traditional Japanese medicine, or what I call TJM, they often think about a gentler approach to the body. Now, this is because the vast majority of TJM styles that the West is privy to are very gentle approaches. Those include Japanese meridian therapy, toyohari, shakuju, and a few others, but mostly it's these three are the top three. Now, saying that, there are a lot of really aggressive traditional Japanese medicine approaches. Again, traditional Japanese medicine is based on the classics, and a lot of classical techniques were actually quite aggressive. One of those that comes to mind is Yanagi-Asore one needle technique, or Ipponshin. Now, this technique, while extremely effective, does use, 12-inch long needles or really thick, big needles like 30-gauge needles and things like that. And so just to let you know, while Japanese medicine often is touted to be a more gentle approach, it can have a much more aggressive technique within it. Saying that, I think the main reason why Japanese medicine, or TJM, is really touted to be a gentler approach in comparison to TCM is because we base most of our treatment off of our palpation and the patient in front of us. So a treatment that is based off of palpation, about the deficient point you find with your finger rather than the textbook, and also based off what the patient is presenting with, is always going to be a gentler treatment than what a textbook recommends. And that's really a huge difference. TCM is based more off a protocol, usually off your Deadman or your other books. It's a little bit more protocol and textbook. Traditional Japanese medicine is very much palpation-based, and this is true of any style. Each style will have its own theory, its own philosophy in TJM, but they're all going to come down to the same foundational palpation-based medicine where they touch to feel where their particular style's stomach 36 or whatever is, right? Whereas, in opposed to that, TCM most of the time is going to be a bit more textbook and a bit more protocol. And that in itself really does allow TJM to be a lot more gentle with the practice. Another thing that makes traditional Japanese medicine a bit gentler is the fact that we use our oshide. Now, the oshide is really important because it allows the needle shaft to be more flexible with insertion, but while it has flexibility, it's very specific on where it's going because we're allowing that guide hand to guide the shaft in. Now, this becomes a bit controversial, of course, with clean needle technique, CNT. So I often tell my students who are more concerned with CNT that they can either use gloves or they can use a cotton ball around the shaft. I personally recommend a cotton ball around the shaft rather than gloves, just because I feel like the gloves really cut off my sensitivity. Now, in opposition to this, of course, TCM is a one-handed needle technique, pulling a little bit more from classical Chinese. Saying that though, what I find is really unique about TCM is they use a guide tube for most approaches. Now, for most approaches, again, this guide tube is utilized. Saying that though, the guide tube is actually a Japanese acupuncture invention. So for those of you who don't know, Sugiyama Waichi was a blind acupuncturist who created the guide tube. You can actually go on pilgrimages and leave things at a shrine in Japan. It's really cool. But I find it really interesting that TCM adapted the guide tube into the technique. Now, if you think about why would they adapt the guide tube from a Japanese practice into a more conglomerated Chinese approach? And that's a really, really simple answer. The guide tube gives more dexterity to the shaft with insertion. So it acts as an oshide essentially as the needle is inserted. So saying that, a lot of traditional Japanese medicine approaches use the guide tube. I think it's a great thing to keep using in your practice. But once you get into certain styles, you can also get into some freehand needling techniques. Like in my style of Yashinomichi, we do both guide tube and freehanded needling techniques. So I really do encourage you, once you're farther into your practice, to explore a little bit, see if maybe you could use a guide tube and maybe you can use freehand, and just try to play around with that a little. It'll give you a little bit more freedom with your technique and knowledge about how the needle is inserted. It's kind of fun. It invigorates your practice when you're maybe 10, 15 years in. Yeah, and it's just fun. So the next place where traditional Chinese medicine really differs from traditional Japanese medicine is the utilization of Moxibustion. Now, Moxibustion, yes, is completely used in TCM, so I'm very grateful for that. Of course, we have stick moxa, box moxa sometimes. Every once in a while, they will do some Chinetsu, which is a larger cone. If you're unsure about that, I'll put a link to that in the description box below for a video about Chinetsu. So they do sometimes use that in TCM. Usually Chinetsu is used more on like ginger or garlic or aconite or salt. And they'll use needle top moxa. So TCM does utilize moxa quite a bit. Where traditional Japanese medicine really differs though from TCM is a few different points. Number one is of course the utilization of half-grain moxa so much in so many styles. Now, half-grain moxa is very difficult to master. Oftentimes this is also called rice grain moxa, and I have a bunch of videos for those, so you can check those out maybe in the description box below or on my channel. But rice grain moxa is really powerful technique, and it's something that TCM and classical Chinese medicine just didn't have in their medicine. It was invented by the Japanese, and so that really makes traditional Japanese medicine differ. Now, with that, I have seen so many phenomenal and amazing results with Moxibustion, in particular with half-grain moxa, for arthritis, for healing cuts, for dealing with bruises, for even getting rid of warts and sunspots and things like that. So moxa can be a really powerful technique. And if you bring it into the clinic, you can get some really advanced things happening in your practice. A lot of practitioners don't use moxa in their practice because they always talk about how the smoke is not something that they can do in their office. And this is another place where I really feel that traditional Japanese medicine has an advantage over TCM simply because we have half-grain moxa in our practice. Now, half-grain moxa doesn't give off a lot of smoke. In fact, most of the smoke that's given off when you're doing a half-grain moxa practice is actually from the incense that is lighting it. So most people just smell the incense, and if you get a good incense, that's going to be a really minimal smell, and it'll be something that won't set off your smoke alarms, it won't bother other tenants in your building, and you can still have a really powerful practice with your client. All right, So saying this, I want to take a quick break and just ask a quick question. How many of you are currently trying to transition your practice from traditional Chinese medicine into traditional Japanese medicine? Let me know in the comments below. Traditional Japanese medicine really differs from traditional Chinese medicine in these three top places. Again, gentler approach to the body based on the fact that we're using palpation, the second one, and also a more effective treatment because we're basing it on the patient's body rather than a textbook. And then also the utilization of Moxibustion treatment. So how can this really affect your practice today, and how can you start to get more confidence in your practice going forward? The answer to these are really, really simple. The next time you have a client on the table, I want you to just palpate them. Doesn't matter if you know what you're looking for, I want you to palpate their chest and their abdomen. Touch and feel. See if you can find for excess points or deficient points, for places of cold or heat. If you're really awesome, you can also look for sheichi or jeki. Now, if that is even one step too far for you, when you're taking your stomach 36 based off your TCM protocols, why don't you palpate for stomach 36 this time and really try to find the place that has the most excess or the most deficiency based on your diagnosis. Also, you can start doing your half-grain moxa practice with your patients. Now, before you do this, a little disclaimer, I would love for you to watch my half-grain moxa practice videos. I'll go ahead and put that in the description box below. We'll just put a whole list there for moxa videos. Go ahead and watch those. Practice on a tissue first, then on yourself, then on friends and family, and then on your clients, just to make sure that everyone stays safe. I would hate for you to burn your client. So by doing just these really simple things in your practice, you can really start to see elevated results with your clients, and you're going to start getting really good questions. Now, this brings me back to the very beginning of the video of making that list of what's really missing for your practice in order to truly transition. And one of those things might be a mentor to help you figure out what you should be palpating for and how to really up your level in your moxa game. Now, if that's the case for you, I would really love if you reached out to me. Let's have a chat. Again, there's a link for it in the description box below. Let's have a chat and see if ShinKyu University is a great fit for that mentorship, or if I can put you in the right direction to make sure that you get a mentor in your local area. The increased patient comfort, the expanded results, and also the confidence that you're going to build in your clinic by simply adding in patient-led, palpation-focused Moxibustion and acupuncture treatments into your practice is not only going to lead to you, again, having more confidence, but it's going to help your practice to expand to new places that you never thought of. This happened very recently with one of my students, James Woodward, and he talked about how he was only an orthopedic practitioner, but after learning these skills and really honing them in over a course of 6 months and then coming to learn with me in Japan with my teachers, he's now expanding his practice into chronic issues. So a place that he never thought he was able to go, he's now able to treat. If this sounds like something that you would like to do, let's have a chat. And you can also listen to my conversation with James by clicking right over here. Thanks for watching, and don't forget to like, subscribe, and hit the little bell. See you.